This morning, our special guests include a very small baby, 18-month-old, so baby Okhe, and her mom is here as well, Petunia. Good morning to all of you. But I want to start the conversation here with a good doctor this morning, Dr. Mamokgeti Rangakak. Thank you so much for joining us. Welcome in the studio. The reason I want to start with you is because you know the full story, and you're going to give it to us in short. How did your relationship, how do you fit into the picture here with this little baby?
Good morning to our listeners. I am Dr. Mamokgeti Rangakak from Steve Biko Academic Hospital. I'm one of the pediatric cardiologists that's working there. Our relationship with Okhe started in September in 2024 when she was referred to us from Polokwane Hospital. We are based in Pretoria, but we get referrals of children that are born with congenital heart defects from provinces like Mpumalanga, Limpopo, and some areas in Northwest. So she was one of the patients that was referred from Polokwane Hospital with a heart defect. Yeah. So she was born with a heart defect in the lower chambers of the heart called ventricles. There is a septum that's supposed to separate the two, but during development, the septum did not develop well. She's got a condition called ventricular septal defect. So we made a diagnosis because she referred firstly to a hospital because she was struggling with breathing. She was admitted with pneumonia. She had recurrent chest infection. She was struggling to breathe and not eating well, not gaining weight. And that's when they made the diagnosis at Polokwane and referred her to us for the heart surgery. Together with Operation Healing Hand, we have actually done last year we did about 18 procedures to close defects in heart children. So we've been working very closely with Operation Healing Hand, and we were hoping to close a heart defect, but we found that it was large and it required heart surgery. Before we
move on to that part, do you remember us taking hands and being part of the storyline and the generosity of our morning family and the listeners of the station? Remember that day?
Absolutely, one of my favorite days. It was absolutely incredible.
So, through Operation Healing Hands, as you said, you are able to help a lot of children and babies and families, but there was more. There was more to it.
Yes, there was more. We found that the defect was large and it was not suitable to be closed with a device, which is what we do in the cardiac catheterization lab, and we had to involve the surgeons. So that's when we got in touch with Mawaneng Heart Foundation, which is also a non-profit organization that worked together with Operation Healing Hand. They also raise funds to try and operate on these patients that need vital heart surgery. They raise, the heart operation will require close to about 200,000, and that just goes only towards the blood products, the consumables, theater time. The doctors and the team, like the heart surgeons, the pediatric cardiologists, the anesthetists, the nurses, actually offer their expertise and their time for free.
That's incredible.
So we're very grateful to Mawaneng Heart Foundation that they're going to assist together with Operation Healing Hand, and we got an angel that actually is going to be donating the money to us.
Doctor, I know you know a lot, but I'll get there. I just quickly want to say good morning, and because we're talking about you, and you're here as well to speak for yourself. But firstly, what are we dealing with here? What is that little teddy bear? What is it?
It's a unicorn.
It's a unicorn.
It's a blue unicorn.
Little blue unicorn. Also in studio with us is little baby Okhe and her mum Petunia. Where are you from? And listen, welcome. Good morning. Welcome in the studio.
Thank you. My name is Petunia Mudau. I'm coming from Limpopo.
Okay, you're from Limpopo. And what do you do there?
I'm studying for now.
Okay.
Yes, I'm studying at Capricorn TVET College. I'm studying safety in society.
Hey.
Oh, wow. Okay. And then how far along are you?
It's my first year.
Okay.
Yes.
So it's a lot, hey? Studying in itself in first year and doing all that's a lot.
Yes.
And then, of course, the challenges with little baby Okhe.
Yes.
It's a lot.
Now I have to attend the baby.
Of course.
Yes. For now.
Look after studies, yourself, the baby.
Yes. It's a lot.
It's a lot. And who's there to help you with all this?
My mom, and family.
Okay.
Yeah, but now she's going to crèche because my mom, she has a piece job to do.
Of course.
Yes.
Of course. She's very good and very quiet. Is she always like that?
Yes.
That's amazing. Does it have something to do with the unicorn? Is that her favorite?
Yes.
So obviously when you found out that there are challenges, you reached out, and when you reach out in a situation like this, I can only guess, when you get the kind of feedback and all these numbers and figures that the good doctor spoke about, it's a lot. It's a lot to deal with, and it feels like, were you thinking to yourself, how am I going to do this? It must be really, really, really tough.
Yes.
But you've got people around you though, good people to support you.
Yes, I have.
And aren't you happy that you connected with?
I'm so happy to find Operation Healing Hands.
Right.
Because I was so stressed.
Of course you were, yeah.
Yes, because they said to me, you have to wait for a queue, and a queue is too long.
That's right.
Yes.
That's right.
So when I found Operation Healing Hands, I was so happy because at the end they're gonna help my daughter. Maybe she will be fine.
Maybe she'll be fine. I think you're in good hands here.
Yeah.
The fact that you connected with Operation Healing Hands, Dr. Mamokgethi, thank you very much for what you do in the first place and the hope that you give parents. And just to get them to say, maybe she'll be fine.
Yeah.
How do you feel? What's the prognosis here?
I'm very, very excited. I think just to say, we've got long waiting lists. Okhe was going to have to wait for 6 months. We've got waiting lists for about 6 months to have an operation which was going to be done probably in August. So we are grateful to Maboneng Heart Foundation and Operation Healing Hand because they actually help us. They do about 10 operation. Maboneng Foundation do about 10 patients per annum. They assist us with that, and they're actually looking for more funders so that at least they can be able to do one per week, because that will actually ease the load
of course
of the waiting list from our side.
So what was the figure you're throwing around earlier when a mom like Petunia comes to you and says, and you do the diagnosis, what kind of number and figure are we talking about? What faces a parent? How much will it cost? Is it hundreds of thousands?
The operation is going to be done at Sunning Hill Net Care.
Okay.
And the operation total costs are actually about 750,000 per child.
750.
So we're actually very, very happy to the Maboneng Heart Foundation. We're happy, very grateful to Operation Healing Hand and to the funders as well that are going to help towards helping the cardiac surgery to improve the quality of life and the prognosis of Okhe.
With the help of all the people that you just mentioned now, there is still a gap, right? There's still funds needed.
Yes.
What are you short? It's about, am I right?
200,000 rand.
So now imagine this. You have all these amazing people jumping in. And you're still short 200.
That's incredible. And all these people are specialists as well, because we're talking about a child here, an 18-month-old here, so they all have to be specialists.
700 just sounds, it's just unthinkable.
Yeah.
But then you're still left with you needing 200,000 rand so that your child can get the best care. And it's not fair, but it is, that's the case. That's where I want to introduce you to an angel this morning, or angels that we all know very, very, very well. Jacqueline Karlberg, representing the DisChem Foundation. Welcome in studio, and congratulations for the great work that you do.
Good morning. Thank you so much for having us.
It's a lot of money, eh?
It's a lot of money to look at this little face.
Right. If it's your child, what you going to do? What's the good news you have?
Well, Operation Healing Hands are beneficiaries of the DisChem Foundation, which is how we came to this incredibly special story. And DisChem Foundation would like to contribute the full 200,000 rand so this young lady can have her operation.
How amazing is that? Petunia, did you hear that?
Yes.
Your baby is going to be in the best possible hands in this country. And to close that gap, thank you very, very much. Listen, I'm already the word's not beneficiary, supporter.
You're a benefit card holder.
Yes.
As was
Fantastic.
That's the one. And a major contributor, may I say, to your company.
Thank you very much. And on that note, may I say thank you to you and to all our benefit card holders, because without you, we wouldn't be able to contribute and to make such a difference and such an impact in the lives of the communities.
My good doctor, you seem very, very happy because this is going to happen.
I'm very excited. Thank you very much to DisChem Foundation. Thank you to Operation Healing Hand and to the Mawaning Heart Foundation. We are so happy and excited for Petunia and our little baby Okhe.
Now that's a smile right there on the mom's face this morning. Are you happy?
So much.
Well, listen, all the best. You're on the greatest hands in the country with your child, with your little baby. You need to come from where did you say? You stay in?
I'm coming from Limpopo, Polokwane.
You come from Polokwane in Limpopo, so I'm sure there's also travel costs involved.
Yes.
From the Good Morning Angels Fund, I'm going to give you 20,000 towards that.
Thank you a lot.
All right. So let's get this done, everybody. My good doctor, get the other good doctors together, and let's have this done. And there we go. Final word from baby Okhe this morning. Good job, everybody. Good job, angels. Good job, everybody who supports the DisChem Foundation in your own special way when we go there. And to you, good doctor, and all your colleagues for being kind and compassionate. There's the final word. Thank you.
Thank you very much.
Good job, angels. Good job.
Good Morning Angels. Breakfast with Martin Bester.